Hello and welcome to Health Professional Radio. My name is Patrick Reyes, and on today's show we have Dr. Joe Kosterich. He is a doctor, speaker, author of 3 books, a media presenter, and health industry consultant. He is a regular on Channel 9 and radio, writes for medical and mainstream publications, as well as maintaining a website and blog providing health information. Welcome to the show, Joe.
Thank you, Patrick. Pleasure to be with you.
Thank you. Now, though I did give you such an introduction, but can you please tell the listeners what it is that you do?
Well, look, I mean, you've pretty much described it there, Patrick. Look, I'm a GP, so I'm a doctor by profession, but over the years I've been fortunate enough to get involved in a few other things, such as the media and writing over the years for medical publications, for a couple of news websites, previously for a newspaper as well, because I think it's very important to try and get messages out there. What you find in a general practice setting is that often you're saying the same thing to lots of people one at a time, and it often is about things to do with diet, with exercise, with weight loss, with managing their stress. And if you can talk to a lot of people and get the same message once through the media, then that is often it's a good way to go, because a lot of people are struggling with similar issues in society.
Now, since you do see a lot of patients every day, and our topic today would be about vitamins and minerals and diets and such. What are the 5 most common vitamin deficiencies that you see amongst your patients?
Yes, you would think that in 21st century Australia we wouldn't really see a lot of vitamin and mineral deficiencies, but we see a lot of low iron, and that's particularly in women of reproductive years, because they can be losing blood obviously each month, and people who are vegetarian and vegan may not be getting a lot of iron either. So that's probably the commonest one. Amazingly, there's a lot of vitamin D deficiency, and some figures suggest that can be as much as 40% of the population. Like a lot of statistics, there will be arguments around those numbers. But the Sun Smart message, which is a useful one, we don't want to go out in the sunshine and get burned, because that's a factor for skin cancer. But if we avoid the sun completely, then we can become vitamin D deficient, so that's quite common. Folate, which is an important B group vitamin, has a lot of roles in the body. Again, we see deficiencies of that. To a slightly lesser degree, we can find there are calcium deficiencies, and a lot of older people, again, depending upon their diet, may need calcium. And the other one's vitamin B12, which, a little bit like the iron, comes mainly from animal rather than vegetable sources. So we sometimes find people on a vegan or a vegetarian diet may be deficient in vitamin B12. A lot of older Australians, unfortunately, their nutrition is sometimes not as good as it could be, particularly people if they're living by themselves. They may not always be cooking nutritious meals, and this is not in any way a criticism, it's an observation. We know it happens. So they can often have multiple deficiencies of vital nutrients. I mean, Patrick, literally I was made aware of, this is not anybody that I saw, but I was made aware of just a couple of weeks ago a case of scurvy, which is vitamin C deficiency in a teenager in Australia. Now, fortunately, that's very, very rare, but the fact that you would get a case at all is quite remarkable, and it just shows you that, unfortunately, not everybody's getting as much nutrition from their diet as we'd like them to be able to get.
Yeah. So how do diets and modern food production impact our vitamin and mineral consumption?
Look, up until fairly recently in human history, people really tended to eat real food. And by real food, I'm talking about fruits and vegetables, meat, fish, chicken, nuts, seeds, berries. We didn't eat foods that came out of packets that were manufactured that had lots of claims on them about what's been added. Modern food production, as soon as food is processed, we're taking some of the goodness out of it. When the more processed foods are, the less goodness that's left in them, because it's just a natural part of the processing. So we often find that people are eating foods that have got a lot of calories. This is why we see problems with obesity and increasingly type 2 diabetes, but not a lot of goodness. And it's because of the amount of processed foods that we do eat, and particularly refined carbohydrates. So a lot of foods, in fact most foods, come out of boxes and packages, but a lot of carbohydrates, but not a lot of nutrition. And even if it says, added iron or added folate or added something, you've got to ask the question, well, why have they needed to add it? So food production does take out goodness. Our diets have moved across to sort of placing convenience above goodness, and we all live busy lives. We can understand how this has happened, but I think what people are now finding is that there is a bit of a price to pay, and we've sort of thought we could have our proverbial cake and eat it too. We can have all the convenience of processed foods, and it'll be all right. It won't be a problem. What we've found after the last probably 30 to 35 years of that experiment is that people are saying we actually really want to go back to eating decent, real food, because we're just not getting the goodness from the processed foods. If you eat stuff out of a box from time to time, it's not a problem. This is not a religion. But if we're reliant on processed foods, packaged foods, takeaway foods, then often these are the sort of people who will need some form of supplement because they're just not getting the goodness from their diet.
I see. Now, which do you believe in more? Is it prevention is better than treatment, or vice versa?
Look, absolutely, Patrick. Prevention is better than cure. I think for a number of reasons. The obvious one being, I think most people don't want to get sick. It sounds a bit obvious when you say that, but if we can not have a heart attack or not have a stroke or not develop cancer, I think, people are going to say, well, I would prefer that option. There are no force fields. We can never guarantee in life that you can't get ill from any cause, and obviously we're all going to die one day, but there's a lot that we can do to make it less likely that you're going to get ill. The other really important thing is health systems around the world are struggling to cope with demand. And there's a lot of talk about ageing populations and increased demand for medical services. In this country, we've got a massive budget problem. There's going to be a certain amount of money that's available for health. It's not a bottomless pit. The analogy that I think is a useful one is it costs a lot less to service your car periodically, to put the right petrol in, to pump the tyres, to do very simple things every day to make it less likely that your car breaks down. If your car breaks down, it's going to cost you quite a lot to fix it. If you look after your health on a daily basis, if you do some regular exercise, if you eat sensibly, if you get enough sleep, if you maybe take a supplement where necessary, that's going to be a lot easier and it's going to be a lot cheaper for you than finding that one day you are quite ill and maybe you're in hospital for a week or two, or you're needing to take numerous medications. So both from a human perspective and from an economic perspective, we really want to be focusing on prevention.
Right. Now, what are the benefits of practitioner-only supplements?
There are so many supplements on the market, and if you go to the chemist or the health food shop, it's often confusing as to which one I should take. And rightly or wrongly, sometimes you'll be talking to a sales assistant who really doesn't have any medical or health practitioner training. So in talking to a practitioner about what supplements you might need, they're going to be able to better guide you as to what's going to be useful for you. They can spend a little bit of time inquiring about what, if any, symptoms you have, also whether you have need for any blood tests or other tests to determine what deficiencies there might be. They can find out how you're feeling. There are a whole range of things that a practitioner can do that I suppose is about diagnosing what the problem or the deficiency might be, or even if it's not a deficiency, maybe you need some additional nutritional support. And so a practitioner who's trained in really sort of getting to what the problem is or what the issue is going to be better able to guide you and say to you, well, this is what's going to be of some benefit to you. So if you're going to spend some money and invest in your health, which is a good thing to do, and purchase some supplements, get the ones that you need rather than just something that you can buy because it's available.
Now, before we go ahead and end our segment, what is a common misconception that your patients have had about maybe vitamin and mineral consumption?
Yes, look, there are quite a few, Patrick. I think the commonest one is that if I get a relatively inexpensive multivitamin that's got everything from A to Z, that's going to be good for me. And unfortunately, a lot of the ones that you can get in particularly supermarkets, and I don't obviously want to give any names, and in chemist shops, yeah, they've got a lot of different components, but they've got so little of each one that you're probably not getting a lot of value from it. And, to that extent, in taking a multivitamin, if you've had a chat with a practitioner, they can generally use ones that have got, in fact, they can use ones that are going to have enough of the nutrients in it that you're going to require. So I think that misconception that if I just purchase something that's going to be helpful, something is not always better than nothing. And if you're investing in your health, you want to be investing wisely, and talking with a practitioner who can direct you and give you some useful advice is going to be a very, very good investment as well.
All right. Well, it's been a pleasure talking to you today, Joe.
You're very welcome, Patrick.
Thank you. Now, you've been listening to Health Professional Radio. I'm your host, Patrick Reyes, and we've been in conversation with Dr. Joe Kosterich. If you've missed our conversation, or if you'd like to listen to this interview again, transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.